Good evening. It
I'm
is
about to put
Tuesday.
myself on mute because
Okay, that's fine. Good
I'm gonna
evening.
put myself on mute because my daughter had surgery yesterday. She's whining.
Okay, that's fine. You're here. That's fine. You'll get your points, Ebony. Yes. Good evening, everyone, and welcome to our 6 p.m. Tuesday class. Today is a review for your Chapter 26 exam, which opens on tomorrow. I will be opening that exam tonight. It is due Sunday. I think Sunday, what is the 19th? November 19th, this exam is due, but it will open on tomorrow. We only have basically, after this week, 3 more days in this module. So we'll be moving on to module 156. So
it's my last module.
yes, Misty will be gone, y'all. She's going to be graduating. Her last day is November 29th, along with several other students. They will be leaving us. So, and then like I said, it goes by really, really fast. So please just like pay attention. Like I keep saying, nobody's called. I have 2 students that I've been tutoring. Nobody has contacted me for tutoring, but yet we have people saying they don't understand. So if you're having difficulty, if you need assistance, please call me so we can schedule a time, and look at a time so that we can go over and review some things. This is new. Some people have never seen a code in their lives. So this is a new program. It's new. But if you're reading and paying attention and looking at your PowerPoint slides, what breaks it down even, easier, makes it easier for you if you don't understand like all of the terminology in your textbook, and looking at videos that I'm posting in the assignments, also showing you how to navigate in code, you will get it. It's not, like I said, you're going to get it overnight. It's a process, but medical billing and coding is reading, 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 reading.
Right.
You have to read. Yes, Miss Julie.
Yes, Barry. I just wanted, before we got started, are you receiving, I'm going to be honest, I don't know how to upload the assignment where it's supposed to. I'm emailing them through my phone to you. Are you getting them?
I'm getting some of them. I'm not getting all of your assignments, but you can also post them in a comment section in the assignment.
See, I don't. So I noticed on day, so I sent one today, which was.
Yeah, I just checked yours. I didn't get day 11. I didn't get one of them that you said you sent.
Yeah, and I did send it. So which one? I'll go back and look and have to resend it. But I don't. Again, may I resend it? Like I did the work. Okay, thank you.
Yes.
Okay.
So, and then one thing I want to mention, I'm glad you're saying it. If you cannot upload, please post in the comment section of the assignment. If you email the assignment, it's going to take me time sometimes to get to it, to upload it, because I have other classes. But if you're posting it in the comment section, when I see it, when I go to that assignment, I'm automatically going to see it. When you send it to me in an email, I have to go to the assignment. I have to go back to the email. Then I have to post it in the assignment. So that takes time. When I'm checking assignments, I'm going through all the assignments first that's posted in either the comment section or have been uploaded. So please be mindful of that. And if I don't get to it that day, it might take a day or two, because you have to remember, I'm also grading exams for not only one class. So I have to go in, grade exams, and then I have to look at and go back through email. So it takes some time when you're sending them separate and not posting it in the comment section or uploading it in the assignment section. So please just be mindful of that. But I will go back and check for you, Julie.
Okay, thank you so much.
Okay, so now I'm about to share my screen. And I'm going to go over what's going to be on your exam, because remember, chapter 26 was very intense. It is a lot of information. You basically have to know the code ranges, what to look for, especially when it's time for immunizations in different categories. So that's what we're going to review, because like I said, again, this exam opens tomorrow, Wednesday. You have until Sunday to take it. But remember, if you go into the exam on Wednesday or Thursday, and you start it, you will have to finish it. You cannot start it and then stop and then try to finish it on another day. Once you start it, you have to complete that exam on that day and at the time. You can start it and then, I mean, like I see a lot of people have on there 180 minutes, 162 minutes. It tells us the exact time. It tells us everything that's going on when you open that exam. So some people leave it open because they know once they start it, they have to finish. That's fine. Just if you start it, make sure you complete it that day, because if you log out, I cannot reopen that assignment for you. So we're going to go ahead and get started where it says right here, remember. And so these are rules. So make sure you pay attention to the rules in your notations. So I want everybody to turn, if you are able, if you have your coding manual, I want you to turn to the medicine section. Everybody's manual should be tabbed. I sent a video on how to tab your manual. Your CPT. So if you have your CPT manual, let me see it. Please raise it up so I can see if it's tabbed. Okay. So you all will receive extra points if you come on and you have your CPT manual.
What are little tab things at? I didn't see.
Excuse me?
I didn't see the little tab things.
They're in front of the book.
I said, where they from?
They're in your book.
Oh.
So Ebony, let me find
Now I
out
see
when you
'em.
open your book.
No, I did. But I think I skipped the first page because I looked for them the first day I got it.
They're in the front of your book, Ebony.
It's like the first page on there.
I just been looking at a guide thing on there
Yeah, so you do
and trying to find the codes. Yeah, I see them now.
Yes. So I also posted a video in the e-learning section, the great section of e-learning, on how to tab your manual.
I watched it. I watched the video.
Okay, so you
I'll
have
go
your
back to
tabs
it after
now.
this. Yes, ma'am.
Okay, so just make sure you tab your manual, because every now and then I might ask for you to show me your manual, and that's how you get extra points as well as being on your Zoom class.
You need us to mark them points too, or no?
Yes, I'm gonna tell them to you at the end.
Okay.
Yeah, so just mark those points and remember to make sure you keep up with them so you can let me know where you want them placed. So turn to the medicine section in your CPT manual and tell me the page that you are on. If you're in the 22, what manual do you have, Shaquana? 2022 or 2023?
2023.
Okay, so if you're in 2023 or 2022, tell me the page number for the medicine section.
715. 715.
And 23.
What module, what book do you have, Jerry?
I got 23 too.
Okay, and what
I
page?
got a 22.
What page is 2023?
715.
715.
Okay.
And in 2022, it's 713.
Okay. So for anyone who's having difficulty with knowing how to get to your sections, that's why the tabs are so important. The tabbing is so important, because if you have those tabs in your manual, you're able, when you see those tabs on the side, to just click directly to that section. So chapter 26, which we are covering, is the medicine section. So to make it easier for you, you know that you should be looking in the medicine section for what we're covering now, especially with immunizations. So if you look in the medicine section, it helps out. It says the medicine guidelines. So they tell you, it gives you the page numbers, add-on codes. So all of your add-on codes are going to be on page 719. If you have to add on a code when they say for certain immunizations where it says add on. Separate procedures, that's going to be labeled. So if you turn to page 719, it gives you the guidelines and everything about your add-on codes. The page, the color is green or teal green. And it says medicine guidelines, and then they have a paragraph about add-on codes. So they tell you, I'm just going to read the first little sentence. Some of the listed procedures are commonly carried out in addition to the primary procedure performed. All add-on codes found in the CPT code book are exempt from the multiple procedure concepts. So it's also important to always read the guidelines and what's stated when it comes to certain codes. So the add-on codes is on that green section. Then they have separate procedures. Unlisted service of procedures. It gives you all of the codes that are unlisted. You turn the page to page 720, special report. It gives you the definition of what is the special report. Imaging guidance. So if you have to do an imaging, supplied materials, foreign body implant definition. So all of that information is prior to, and it gives you the page numbers where you need to find that information. Moving down back to page 715. For you, Misty, is 713.
Yes, ma'am.
The medicine section. It's telling you, it's giving you the page numbers. Immune globulins, serum or recombinant products. It's telling you the code range and what page it's on. If you go down, vaccine toxoids. So when you're looking for anything with a vaccine toxoids, like with this PowerPoint slide that we're on now, where it says, remember, do not assign modifier 51 with vaccine toxoid codes. So you know you're not going to use modifier 51 with the vaccine toxic code. Rather, depending on the payer, that means whatever their private insurance company is, if it's Medicare, Medicaid, whoever their provider is, it says list each code multiple times or use times, the X symbol, and indicate the number. Modifier 51 should not be reported for the vaccines, toxoids when performed with these administration codes. So in this code range, 90460 through 90474, you're not going to use modifier 51. And if you look in on the page where it says 90460, on the immunization administration for vaccine toxoids, on that first page, the second one under immune globulins, it says immunization administration for vaccine toxoids, 90460, and it has the 01128. That's to that code. You're not going to use it. It's telling you on page 722. You're not going to use a modifier for that code, for that vaccine. It says under that PowerPoint slide, the gray section says list the codes multiple times or use times symbol and indicate the number of injections given. So that's for certain providers. They want you to list how many injections you provided to that patient.
I already put it back in.
That's going to be in your patient's medical record. So moving right along, if you look back where it has biofeed section. So when you turn in the medicine section, if you're having difficulty with understanding, look in that front part of your medicine section, biofeed. Anything dealing with biofeed is going to be in 9901 through 9913. If you go to 9914, you know you're out of the biofeed section. Dialysis, 9935 through 9999. So if you go into another section, you know that you're no longer in the dialysis section. So I want you all, especially for my newer students, to become familiar with your CPT manual. Always look at the index, the guidelines that they're using. Look at those page numbers. It's going to help you to familiarize yourself on how to look at those code ranges. And then it gives you the page numbers on where it is. So if you're just learning and you don't really know how to use that tabular and know, like right now, when we get down on this PowerPoint slide, when it says about biofeed, you're going to know, and you can see too, you're going to know that biofeed is going to be in that code range. So when you're flipping through the book, you know you're going to be looking between 9901 and 9913 if you're just learning, you don't understand how to find the code. So you guys are going to take some research. So next slide. because this here about these is on your exam. So important reporting rules. If vaccine is administered during the office visit, not related to EM, what does EM stand for?
Evaluation management.
Right. You have to know the terminology. You have to know the abbreviations. They're not going to have it written out in that patient's medical chart. EM is evaluation management. So if vaccine administered during office visit is not related to the evaluation and management, report EM service with modifier 25 plus vaccine plus administration. It depends on the local carrier. So it depends on that insurance company. And when you send that bill off, and for quote, they'll let you know if you didn't do it right on what they expect. Office visit for vaccine only. So if they went to their office for a vaccine only, code only vaccine, no EM service. And that also depends on the local carrier. It says under the PowerPoint slide, if the office visit takes place only because of immunization, report the immunization administration code first and the vaccine toxoid code second. Routine vaccinations. Influenza administration. This is in your HCPCS manual. We'll be getting to that in your HCPCS manual. G0008. Medicare only. This is the code range, 90471, 90472. Substance, trivalent, IIV3, influenza virus vaccine. So when you do immunizations, you all, the medical assistant or that nurse or whoever is doing it, they're going to have what that administration, the immunization guidelines are for the different ages. What vaccines you take at age 2, 3, 4, 5. All of that will be, and all of that will be in the patient's medical chart when you all get ready to bill for that service. Pneumococcal administration. If they only have Medicare, if they have Medicare only, no other type of insurance, you're going to use the HCPCS G0009. That's for Medicare only. Any other insurance companies, Blue Cross, United Healthcare, Humana, that's private, you're going to use 90471 or 90472 for administration. Substance. And so it goes on. So you always have to make sure with that front desk person. So if you go in, when you get that certification for medical office assistant, and you want to start there first before you get into billing and coding to get that experience, this is the kind of stuff that you will be taking in what type of insurance that patient have. You're going to be putting that in that medical chart. If it's Medicaid, if it's Medicare only. So when you send that patient's record to the back, they're going to look at what insurance carrier they have to know on if they're going to use a HCPCS code or if it's going to be a regular CPT or ICD-10 code for you to bill for. So that's what that front office staff is responsible for. It says these two vaccinations are commonly provided, influenza and pneumococcal. It says, what does trivalent mean? That means 3 viruses, which tri means 3. The third-party payer may require CPT codes or CPT with HCPCS code for the service. So that depends on if it's Medicare. Medicare is going to ask for that HCPCS code. Non-Medicare is going to be for the CPT code. For Medicare patients, the coder reports only an administration code of for an administration and immunization. If no EM service is reported, EM office visit include the administration of an immunization. So now look in your CPT manual. We're still in the medicine section. Look, and it's going to say psychiatry. That range for psychiatry. So in the front of your CPT manual, I'm trying to show it a little bit in here. In that front part, it's showing you the range for psychiatry. 90785 through 90899. And it's on page 731 where it starts. So if you turn to page 731,
Seven 27 for me.
Okay, for you in 2022, it's 7:30. You said
727.
7:27 in the manual for 2022. That green section starts psychiatry. Always read the guidelines, what it says. What psychiatry services include? Diagnostic services, psychotherapy, and other services to an individual, family, or group. Read the information when you look up the code, when you're looking for those codes. That's in the manual. So just become familiar before you just looking for a code. Read those notes. And it tells you the code range. Psychiatric treatment at same time as EM service report, one code for therapy with evaluation and management. Example, 9833 psychotherapy and EM. Time major billing factor, codes divided on time. Medical record indicates session time. So in that medical record, it's going to be documented in that patient's medical record, the time that was spent for that treatment. And then you're going to have to bill on time. It says the psychiatry section has a lengthy note under the heading, which you all can see on that page, on page 731, 727, and 2022, the notes that's under when you begin, when you're reading that psychiatry note. They said the heading that details the use of psychiatric codes in conjunction with hospital and clinic evaluation management services. If psychiatric treatments are rendered on the same day as an evaluation management service, both are reported with one code from the psychiatry section. If these treatments are provided on a different day from the EM service, a code from the EM section is listed. Some codes reflect evaluation or diagnostic services. Some reflect therapeutic procedures, and some reflect psychological testing. So always, I just show you, go through each section. So in the medicine section, you're going to look at each section on that page and look at the code range for whatever we're going to be covering in this section. It goes on. When selecting a psychotherapy code, ask these questions. So this is important. This is what you need to ask when you're looking for a code in the psychotherapy. First thing, how much face-to-face time is spent with the patient? Because you have to bill for that time that's spent with the patient. Does documentation support an evaluation and management code in addition to psychotherapy? If rendering psychotherapy is the approximate time of the psychotherapy noted in the medical record. So all of this has to be documented in that medical record. So you understand, do you see how important your role is as a coder and biller? You have to be able to bill for every service that's in that record. So because that's how you get the money for that service. That's how the business stays open. That's how you get paid. That's how the clinic get paid. The doctor gets paid. So you have to document, you have to look at, because everything is going to be documented for you. You have to know how to go through that medical record. When they turn it into you to bill for services, you have to know how to pull out all of that information to be able to get the most money for that service. So remember, these are the things, these are the questions you have to ask for a psychotherapy visit. Many services provided in partial hospital settings. Patient in hospital during day, returns to home for evenings and weekends. Interactive psychotherapy is typically furnished to children. It uses play equipment, physical aids, nonverbal communications, or other mechanisms of communication. EM initial hospital care and subsequent hospital care codes 99221 through 99233 are used to report inpatient stays.
Say it again, Ms. Berry.
EM, yes. evaluation and management, initial hospital care, and subsequent hospital care codes are the range of 99221 through 99233. And they're used to report inpatient stays. So which book will you really find and look through for inpatient stays, Misty?
You would look through the evaluation and management, right?
Correct. Correct. You see, Misty, I'm trying to get you about to graduate. So, you know, you have to remember this stuff. You're about to take that certification exam real soon.
Yes, ma'am.
Yes, so here we go. Here is the biofeedback. So on that front cover for medicine guidelines, it says biofeedback, code range 9901 through 9913. So look in your, when you're looking on this PowerPoint slide, and if you look in your textbook, it is the same code range. Biofeed 901 through 9913. So biofeedback, it says it's used to help patients gain control over body processes. Example, high blood pressure or chronic pain. That's what biofeedback is for. This is important to understand right here when billing. Medicare coverage issues manual 35 through 27 restricts the use of biofeedback. So if they only have Medicare, Medicare will not pay for biofeedback. And biofeedback is for patients to gain control over body processes. An example of that, high blood pressure or chronic pain. Medicare doesn't cover biofeedback for psychosomatic disorders. So if it's due for a psychosomatic disorder, Medicare will not pay for it. And again, under your PowerPoint slides, make sure you look at that gray section under your PowerPoint slides. It gives you the exact example for it. It says here, biofeedback is a process by which individuals can monitor and manage physiological processes that are normally out of their control. This is what biofeedback is. Patients training in biofeedback by professionals continues on. Service is often part of psychophysiologic mind-body therapy. 9912, so look at the times. This is important. This is how you're going to be billing. 9912 reports initial 15 minutes. 9913 add-on code reports additional 15 minutes. So you always have to make sure that you're paying attention to the time that was spent for that therapy session. Dialysis. In your book, under the medicine section, under that biofeedback, I'm holding my book up. Next is dialysis. 9935 through 9999. And it tells you dialysis starts on page 736 in the CPT manual for 2023. What is the page number for you, Misty, for 2022?
732.
2022, it's page 732. 2023, it's page 715. Dialysis, the range 9935 through 9999. So it tells you here, look at the dialysis machine. It says dialysis. It cleanses blood, temporary non-ESRD. What is ESRD? That's one of your daily.
That's on that
renal
pizza.
disease.
I couldn't hear you.
End-stage renal disease.
Yeah.
Correct.
That's
That
on
was
that
one of
thing
your
you
assignments, one of your daily
Yeah.
assignments.
did.
Yes. You see, and
Let's
look,
hope I got that right. Let's hope I wrote that down right after I
yeah,
got it right.
so this, like I'm saying, I keep going over and over. They're not going to have in that chart end-stage renal disease. That's too much to write. So it's going to be in the ESRD. So again, making sure you become familiar with these acronyms, abbreviations, and all of this good stuff, because the charts are going to be basically shorthand. So you're going to have to figure it out and try and understand what these, acronyms mean. But if you do not understand, remember, ask that doctor, ask that nurse, ask whoever is in that supervisor to help you. This don't not bill or not charge because you don't understand what it is. Ask.
Right.
So dialysis, it cleanses blood, temporary, non-end stage renal disease, permanent end stage renal disease. 2 parts to report for end stage renal disease with dialysis service: the physician service and the hemodialysis procedures. So under this picture, it states patient receiving hemodialysis, and it's just showing how the machines use, how it filters the blood. And a lot of times when they're going through dialysis, after that, they're drained. And it tells you right here, see, it asks the questions, and these are questions that's on your exam. So please, I keep stating all the time, look at the grade section under your PowerPoint slides. It asks a question and then it provides the answer for you. What is the specific purpose of dialysis? It removes waste products from the blood when the body, which is the kidneys, cannot perform this function adequately. End-stage renal disease, ESRD, requires permanent, ongoing dialysis. So once you get to the end-stage renal disease, it's permanent dialysis to keep those toxins and poisons out of the blood. So it cleanses the blood, and that's why they go to dialysis. Some people go 2 to 3 times a week to get those bad toxins out and filter the blood. End-stage renal disease services include establishment of dialysizing cycle, physician services, EM outpatients dialysis visits, patient management during dialysis, reported for month. So see, this is the difference. If you're reporting for the month, 9951 through 9966. So on here, less than full month of service, it's going to be 9967, 9970 per day. Codes divided on age. This is a number important for dialysis because this is how you bill. The codes are divided on age and number of visits. Dialysis services are usually billed as a monthly fee and are performed on an outpatient basis. So that might be a true false, right? I might have on there, dialysis services are usually billed every 2 weeks and perform on an inpatient basis.
No, my uncle, before he died, he was in dialysis.
Right.
And,
so now,
yeah.
when it comes to billing, if you're working in that department, if you're working in a dialysis center and just doing the billing and coding, that it's billed as a monthly fee and performed on an outpatient basis. How are physician services for dialysis reported? By the type of dialysis the patient is receiving and the number of doctor visits. Hemodialysis is the procedure used for end-stage renal disease and non-end-stage renal disease. Billed per day, look at the difference. Billed per day for inpatients receiving end-stage renal disease plus non-ESRD, includes all physician evaluation management services related to procedure. Use modifier 25 if separate EM service provided. What is the function of hemodialysis? To route blood outside of the body for filtration of waste products. How long does a patient suffering from ESRD need to be on dialysis? forever until he or she can have a kidney transplant. And you know, that's hard. Most times you're on a waiting list for a kidney transplant.
Mhm.
Miscellaneous. So for miscellaneous, that's under hemodialysis. It's in red. Still under that medicine section in your book. Miscellaneous dialysis procedures. It tells you that code range, 9945 through 9947. It starts on page 737 in 2023. Turn to page 737. And at the bottom of that page in 2023, it states miscellaneous dialysis procedures. Then when you look to the right of it, it says end-stage renal disease services. So if you become familiar with this CPT manual and you're looking on that page when you get ready to look in the medicine section along with your tab CPT manual, this is going to help you with looking at what you're looking for. So when you're in your book and you're looking for a code and it says miscellaneous dialysis procedures, you're going to turn to the medicine section. You're going to look under that section where it says medicine, where it tells you all of the page numbers or whatever you're looking for. And you will say, okay, miscellaneous dialysis procedures, 9945 through 9947. Oh, that starts on page 737. So you already have a guide as you know where to start to look. So you're not just flipping through everything and you don't know what you're looking for. Next, any questions?
Yes, ma'am. Miss Spears. So I was reading the grade report, and it says, for example, if the patient had an upper respiratory infection and say with a cough, you're going to code it separate, a separate EM code with a 25 modifier. Would you give us the example, like give me the code, like the full,
So
just tell me what it looks like?
Okay, so when you get your manual,
yes, ma'am,
in the front cover of your CPT manual, every modifier is in a front cover.
okay.
So Shaquan, I know you're new. Turn to that front cover of your CPT manual and you're going to see all of your modifiers in the front cover of your CPT manual.
Yeah, I see it.
So when you get your book, Miss Julie, like I'm going to check on all of your modifiers, it's going to be listed in that front cover and they're going to tell you, each modifier tell you what it's used for.
Okay. All right, Miss Erin.
Yes. So it'll tell you, like, just like for 51, when we went through that, it tells you not to use 51 with the immunizations and toxoid vaccinations.
Right.
When you look in the front of that cover, it's going to tell you what each modifier stands for, when to use it, where you use it.
Okay.
Okay.
Yes.
Okay, thank you.
You're welcome.
Okay.
So like you were looking at this grace, it says peritoneal dialysis using the peritoneal cavity as a filter. Peritoneal dialysis is a continuous renal replacement therapy. If a physician sees a patient during the dialysis session, how would this be coded? If the physician sees a patient during the dialysis session for something other than what pertains to the function of his or her kidneys, for example, the patient has a cough and is diagnosed with an upper respiratory infection, you would code a separate EM code with a 25 modifier attached. And then what usually happens, Miss Julie, is then if they don't treat that, they'll give you a referral for you to go and see somebody that deals with respiratory infections, that usually that's what doctors do. Like say like with a gynecologist, you go and see a gynecologist and you have high blood pressure. Most of what he's going to do is he's going to refer you to the hypertension clinic or somebody who specializes in that area.
I think because I don't have the book. So for example, the peritoneal dialysis, okay, miscellaneous dialysis, I guess I was just looking for like, to say they had that procedure, is it 90945? And then they've seen them for a cough. So I got to throw in another code for the EM. and the cough and then put the -25 behind it?
So with that one, like I said, you would only put that 25 because first of all, he's not going to code anything for that respiratory infection because that has nothing to do with what he's doing.
Okay.
So he's going to use that to code that, they had that as well, but then he's going to give you that referral.
Okay, I got you. Okay.
And then you have to go and see that specialist.
Yes, ma'am, I understand.
And then like Miss Julie, once you get that book, and then
It'll
also you have your ebook.
Yeah.
They have other examples in that ebook as well.
Okay. All right. Thank you. Yeah,
You're welcome.
I need the actual book.
Yes.
Yeah, that would make it easier. Yeah, make it a lot easier.
So here is an example, like on the page, and this is also in your ebook, but you can expand it and make it much bigger as well. Like say, like make copies or print it if you would like.
Yes, ma'am.
So your peritoneal dialysis services billed on per day basis for inpatient end-stage renal disease patients. So it's showing you the drainage, what is happening. It's showing you how and what is going on. The catheter, the peritoneal dialysis solution that's put in and how they're cleaning and draining. Peritoneal dialysis is reported monthly or if less than a month for each day the service is provided. How is peritoneal dialysis reported for Medicare? Monthly or per day using temporary HCPCS code. And that's another manual, HCPCS manual that we'll be getting into as well. Dialysis training. Patients can receive training in self-dialysis, reported with 9989 and 9993. Codes divided by complete or partial training program. Where are dialysis teaching codes located? So it's telling you it's located under miscellaneous dialysis procedures. Most third-party payers allow training to be billed for one time only. Look in your book when they have on there next, gastroenterology. Gastroenterology. It's printed in bold green, 91010 through 91299. 2023 manual. It's on page 739.
735 for 2022.
Thank you, Misty.
You're welcome.
And that for me, it's the left-hand side, right side, gastroenterology. And it tells you 91010. It starts and it tells you the different things. So when you're looking, you're going to be looking at what that code is stating, but you know that's where it starts at. So then if you go on to 91122, 91132 starts gastric physiology. So you'll know that if you're not in that right section, if you're not looking for gastrophysiology. So right here, gastroenterology is for test and treatment of esophagus, stomach, and intestine. So, gastro, all of that deals with the stomach. Gastroenterology, look at that first range. It says for test and treatment of esophagus, stomach, and intestine. Codes usually reported with EM or consultation service code. Caution. So with gastroenterology, it's many bundled services. Several intubation codes are listed in the gastroenterology subsection. Coders must carefully review the code descriptions to determine which services are bundled into the code. So you're going to basically have to read anything dealing with gastroenterology, which services are bundled, because a lot of times these services with test treatments of esophagus, stomach, and intestines are bundled into one bundled code. Ophthalmology. Green section starts on page 741 in 2023. 92002 to 92499.
737 and 2022.
Great. Contains EM codes, not EM codes from front of CPT. So that's a difference. It contains evaluation and management codes, but not from the codes in the front of the CPT. Definitions for new and established patients, same as for EM section. Most codes are for bilateral services. So what does that mean, bilateral?
Two, both sides.
I didn't hear you, Misty.
That wasn't me.
Oh, who was
Both
that?
sides.
Bilateral.
Bilateral.
Meaning
I mean both
two?
sides.
Yes,
Both sides.
yes. Bilateral means two. So most
Okay.
codes are for bilateral services in ophthalmology. If only one eye, see, Julie had it telling you. So if it's only one eye, you're going to use modifier 52, reduced service, because you're not servicing a bilateral service. Bilateral is always going to be for two, and that's in ophthalmology because it's, you know, two eyes. It says, read the definitions of intermediate and comprehensive services in the CPT. So under the gray section, under the PowerPoint, it says, extensive subsection notes explain levels of service and present examples to clarify the codes. Codes are based on whether the patient is new or established and on the complexity of service received. For coding purposes, what is the definition of a new patient? So this is important for my new students as well. A new patient is classified as one who has not received any professional service within the past 3 years from the physician or another physician of the same specialty in the same group practice. New patient, make sure you all know that a new patient is one who has not received any professional service within the past 3 years from the physician or another physician of the same specialty in the same group practice. That's the definition of a new patient. It is important to note the difference between intermediate and comprehensive as it pertains to this subsection. So when you look at an ophthalmology, and most times, if you're in an eye clinic, then you're going to have these code ranges because you're only going to be billing for things dealing with the eyes. You know, cornea displacement, retina rebuild, all of those things. So that's a specialty clinic. So just like if you would go somewhere, like they're saying you're having with diabetes management and you're having something called glaucoma, they're going to refer you after that to that specialist, the ophthalmologist. They're going to give you a referral. Then they are the ones that would provide that surgery. If you have to have a cornea replacement, a glaucoma, you know, that ophthalmology is going to go through all of that. Next. So we're going to go through these special, if you look under that special ophthalmological services, 92015 to 92287 starts on page 742. They have general ophthalmological services and then special. For special evaluations of audiologic system, go beyond those usually provided in evaluation, may be reported in addition to basic audiologic service. Make sure you read through these PowerPoint slides. It says the service in this subsection deal with special testing or studies for the ears, nose, and larynx. Who can perform an audiology test? A physician or trained audiologist. Special treatments and diagnostic services. Example, nasal function tests, rhinomyometry, or audiometric tests. All hearing tests, bilateral unless indicated, one ear in description, use modifier. Here we go again. I want you to see, Julie, 52 for one ear.
One ear. Yes, ma'am. Yes, ma'am. I see it. Thank you.
Right. So I just want you to, so when you're looking in your book, when you get your book, you will be able to look at those modifiers and how they explain, and they tell you when you look in that section in the book, it's going to explain to you if it's one, which is uni, or bilateral, two.
Okay.
Next, we have the coronary therapeutic services and procedures. So making sure right here, 92920 to 92921. Cardiac catheterization, diagnostic medical procedure. 3 components included in most cardiac catheterization codes. This is on the exam. 3 components included in most, not all, see what I say, in most cardiac catheterization codes: catheterization, injection, and imaging. The 3 components included in most cardiac catheterization codes: catheterization, injection, and imaging. Cardiac catheterization is a diagnostic procedure that includes the introduction, positioning, and repositioning of a catheter to aid in diagnosis of the heart. Also included is recording of pressures, obtaining blood samples, and cardiac output measures. The first component of coding heart catheterization is the positioning of the catheter. That's the first component, the positioning of the catheter. Code selection is made based on where the catheter will be placed. So that left was at LHC, RHC, and BHC. The second component is the injection. These are coded by what vessel is being injected. Last is the imaging. Only 2 codes. Read the descriptions carefully that you don't get those 2 codes misconstrued and you put it in the wrong place for that code. Anticoagulant management. Outpatient management for warfarin therapy. Training in I&R monitoring. Billed once per day. Any number of tests reviewed. So for these, I just need you to go through the rest of these PowerPoint slides.
Hey, I'm
One other thing I need you to make sure you pay attention to: allergy and clinical immunology, 95004, 95199. They're divided into 3 subheadings: allergy testing, ingestion challenge testing, and allergen immunotherapy. And they give you the definitions for which each one stands for. Each one tells you allergy testing, sensitivity testing, ingestion testing, sensitivity to food, drugs, and other substances. It tells you how many minutes, reports initial 120 minutes testing time. So it gives you the code range, and that'll be in your manual showing you on how many minutes and what's billed and what code you would use depending on the minutes and the time that it took to provide that test. And then the allergen, coded, divided into 3 types of services: injection only, prescription and injection, provision antigen, substance only. Codes 95115 and 95117 are payable in an office setting. At the bottom, it says all codes for allergen immunotherapy have specific notes that describe the service. It says, how are these codes divided out? Injection only, prescription and injection, and substance only. So this information here will be on your exam. Continue to read the rest of these PowerPoint slides. Read on neurology and neuromuscular procedures, central nervous system, CNS assessment test. So you have until Sunday to take this exam. So make
Okay.
sure that you read the rest and go through the PowerPoint slides, because remember, tomorrow the exam opens, but remember on Thursday starts a new chapter.
Okay.
So when we have the exam, even though you have until Sunday to take the exam, once that exam is open, which it starts on Wednesday, you just have those days to take it until Sunday, a new chapter starts the next day, because that exam is Wednesday, but your new chapter for chapter 27, let's see, what is chapter 27? Let's see. Chapter 27 is
Inpatient coding.
inpatient coding.
Okay, Miss Berry, one other thing.
Yes.
So the exercise 26-13, that's the one due tonight, correct, ma'am?
Yeah, day 13 is due tonight.
Is there a lab due tonight? Or is it just that one exercise?
Labs are due, like I said, you have your day 13 daily assignment and your lab, but you have 7 days to do your lab. So your lab, you should do it tonight if you have the time. That's easier for you.
Okay, what lab is that for tonight? I can do it
Lab 13. Each lab the same day, like if it's day 13, a daily assignment, it's the same day for the lab.
Okay.
The assignment that was due for today was 2613 was yesterday.
There's
20
Jared.
Hey,
Yeah, so it's 26. Actually, I'm not on, that's why I don't know. So today is day 4.
Was it due today or was it due last night?
2613 was due Monday night.
Yeah, today is a whole different one with the
What's the
pretest
one
and
due
stuff.
tonight?
The one today is the one with the pretest and
the
about
The
pretest,
mental practice question.
Yeah, the immunization with the two with the 20-year-old with the 2 vaccinations. That's the assignment that's due today.
Right, and so make sure that you all are reading that, because I'm giving y'all pre-tests to let you know what's on your exam. So go through those pre-tests. Those things will be on your exam. That's why it says pre-test.
Okay. Okay.
Yes.
Well, thank you, Ms. Berry.
Yes, so every day, so remember, whatever daily assignment you have, that's going to be the lab as well that you have to complete. But best practice is you try to do it on that day. But remember, you have until Sunday to complete your labs.
Yeah, I don't want to.
But if you do them daily, you will be done by Friday, and then you don't have anything else to worry about over the weekend.
Yes, Lord.
I appreciate you.
Yes,
Okay, thank
but
you
like
so much.
some people want to do that, and then I get these emails. Something came up, and they have 5. They want to do 5 and 6 labs at one time, and then they can't do it because the labs are much longer and more intense than your daily assignment.
I feel like you're shooting at me again.
Jared, what?
Oh, I already sent mine, Miss Berry. I re-emailed mine.
Okay. Good.
Normally it's me she's picking at.
We don't pick on nobody.
That's me today.
All right. Well, I gotta run, y'all. Thank y'all.
Okay, so write down your points, Julie. This was 10 points. And for those who were able to show me their tab manuals, get 5 additional points.
Oh, okay.
So you will get the 10 points. Once when I do it again and ask for those, Jared, you didn't show me that tab manual, Jared. Okay, so you almost missed out because you didn't show me that earlier. You had that camera off.
Okay, y'all have a good one. Thank you.
Tyra, I didn't see that book. You at home now. Where's the manual? Don't cover your face. Don't put it down now. Where's that manual? Where's that tab manual?
I'm not even gonna lie to you. I ain't do it.
Oh, look at that, Jared. Jared, do you see that?
I'm sorry. Jared, where you was at when I needed you? Yeah, Jared, you is failing me. You is failing me.
I thought you were calling Jared at the time. Y'all supposed to tab your manual.
We sure was supposed to.
I know. See, Jared don't care about me. I'm about to find me somebody else to hang on to.
Don't do that. Don't do that.
Hi, I'm right here.
And the manual.
How you doing?
Okay, I'm gonna have to hang on to Missy. She about to leave, but I'm gonna have to hang on to her. So
So
Jerry, they keep to the side.
10 points for this class, 5 additional points for the tab, CPT, manuals. Tyra, you've been in here too long not to have that manual tabbed.
Oh,
Yes, I'm calling
tonight. I'm gonna do it
everybody out
tonight.
there.
I'm
Look
gonna
at
do
that,
it tonight.
Shaquana just started and she have her manual tabbed.
Ooh, and I'm gonna have my test done by Friday.
See that? She's rolling. She is
Oh.
rolling.
Man,
Ebony.
I ain't gonna lie to you. I'm not
Ebony
gonna lie
got
to
to
you.
tab yours, Ebony.
On weekends, I like to enjoy myself. So I get what I gotta get done because I like to enjoy myself.
Yes.
I will tonight.
Okay, Ebony. Great. So remember, 10 points. So look at that, Jerry. You got those 15 points again.
See, there he goes. See, I told you, Jerry don't care. He want me with them 10 points. That's all he want me with.
I actually
You
made
got
it for a
10
6 o'clock meeting, so I got them this time.
So you all, I will be recording this later and sending it to you all. Remember, it's in the grade section of e-learning. I also send it to you in an email. So please watch if you have to go back and do a refresher. But remember, look in the front of those sections, like we're in the medicine section. When you have that tab, turn to that medicine section. Look at all the different breakdowns they have, and that'll assist you as well as knowing what code range and how to find those codes and where to start, and then doing your research of what to look for to find those codes.
I can look at it 3 different ways because every single time you post something up on YouTube, I see it go up.
Yes. So it's on YouTube. It's in your grade section of e-learning. It's in your email. I'm trying to get it to you all type of ways so you can get the information. And I also post videos in your assignments that shows you like different ways on how to get those basic terms to know what to look for. And that's contempo coding. So just make sure that you're looking at those things. Remember, if you have any questions or concerns, give me a call. We can do a one-on-one session, one-on-one tutoring if you're having difficulty. So last note, you all have a great weekend. The exam open tonight is for Wednesday. You have until Sunday. If you have any questions, email, text, or give me a call. And Jared, what's my thing? What I say, Jared?
You got to stick to the business hours. Don't email after third time. You got business hours.
Oh man.
Do not call me on Saturdays or Sundays about no assignment.
Boy, you ain't gotta worry about me at all.
No assignments. You can email me. And if y'all notice, like even if you email me sometimes, I do respond by email sometimes, but please do not call me. And guess what? Next week, y'all are off Thursday and Friday. So you have a 4-day weekend.
That's what's up.
Thursday, Friday, Saturday, and Sunday.
Thank you, Jesus.
So that is great. So you all have a great Tuesday night and Wednesday, and I will see you all Thursday for 4 p.m. Remember, Thursday starts chapter 27.
Yes, ma'am.
Thursday starts chapter 27, and we will be moving on in a couple of days next week to a new module 156. So enjoy your evening, stay safe, and I will see you all on Thursday for 4 p.m.
Yes, ma'am.
Bye-bye.
Good night.